Hi, I'm John Cullen. Welcome to another episode of Hypothetically Speaking. In this episode, we're going to take a look at some footage that I was able to locate. I actually just stumbled across this. And this is an old interview of Dr. Fauci with Mark Zuckerberg from Facebook. And what's interesting is that this interview took place March 20th, or it was published March 20th, 2020, and that's about the same day that I published the video about Beijing, asking Dr. Fauci, is it true that there's only 4 people dead in Beijing, or less than 10 or something like that? So coincident with me publishing that video, Dr. Fauci sits down for an interview with Mark Zuckerberg. And what's interesting is to hear the perspective on the pandemic in March of 2020. Now, this is March 20th, which is 1 week from when the president declared a national emergency. So the president of the United States declares a national emergency on March the 13th. And then March the 20th is this meeting between Dr. Fauci and Mark Zuckerberg. So let's listen in. I'm going to stop along the way to comment and insert some observations and see what you guys think. But let's get started with Dr. Fauci and Mark Zuckerberg.
Continue to get more and more cases. But the response to that, which we can get into a little bit, is going to mitigate how bad this is going to get and how much the peak is going to be.
Yeah, so before we get into that, maybe you could just talk for a minute about what are the projections that you're currently seeing? What do people expect in the United States, in Western Europe, in the countries where there are currently outbreaks that are growing very quickly? What can people expect in terms of how this will affect their communities, how this will grow, how this will affect them?
Well, first, let's see what the virus is going to do, and then you could kind of extrapolate that into what the impact would be in a country. If the virus is left to its own devices, you will see a major, major peak, which will then turn around and come on down. In China, even with their major, rather draconian efforts to contain it, they got off, I wouldn't say to a bad start, but it was a start where they were not expecting it.
All right, so there's a couple observations already. First of all, Dr. Fauci does not Dr. Fauci does not mention multiple peaks. He doesn't mention 2 nodes, 3 nodes, a binodal, trinodal outbreak at all. He says it goes up and it comes down. And the other thing that we've already noticed is that he's paying attention to China and what's happened in China. So this is March 20th, 2020, and Dr. Fauci clearly has an eye on China. Now, I had just published this video that day or the next day asking about Beijing and the fact that there weren't 10 people dead in Beijing. Wasn't that relevant? So let's continue.
It took them about 2.5 months to get to the point now where there are very few cases in China. Europe, particularly Italy, is right.
All right, so he just said it, to get to the point where there's very few cases in China. So in March of 2020, Dr. Fauci is acknowledging that there's not that many cases in China. He just said it. Let's go back a couple seconds here. Listen to what he said.
Where they were not expecting it. And it took them about 2.5 months to get to the point now where there are very few cases in China. Europe, particularly.
To get to the point where now there's very few cases in China. So March of 2020, he was aware that they went through it and were just about done with it by March. So I found that interesting. So now he's going to talk about Italy and a bunch of other stuff. Let's hear what he has to say on this.
Italy is right now in the phase that they're still accelerating. So they've had a few weeks of an acceleration. They've not been able to contain it. So the same thing likely will happen somewhere around 8 weeks or so until it goes down enough that you could feel you're almost out of the woods. We now are still in the escalation phase. How high that gets, Mark, and how long it's going to take to turn around is going to be very much dependent upon how successfully we do containment and mitigation, the kinds of physical separations of people that have now been part of the guidelines.
All right, what's important here is that he's talking about physical separation, social distancing. He's going to talk about, I think he may talk about mask wearing. We'll see. But what's going to become clear to you as we go through this is the vaccine is not really a part of the strategy in March of 2020, other than from a longer-term perspective. So listen closely to what he's talking about as far as how to mitigate the disaster. I'm going to go back a couple seconds here, but listen to what Fauci says about mitigation here.
We do containment and mitigation, the kinds of physical separations of people that have now been part of the guidelines. It's rather disruptive of society, certainly is. It's inconvenient, but it's that kind of thing that's going to determine. So right now, if we do well and we're really successful, at a minimum, it's going to be several weeks.
At a minimum, it's going to be several weeks. Interesting. All right, now watch how Zuckerberg responds to what Fauci just said.
Yeah, well, some of the projections that I've seen suggest that more than 50% of people might end up being exposed to this over the next year or so.
Over 50% of people. There are 340 million people in the United States. So that would mean that about 170 million people would need to get infected. And that's not what's happened, right? So there's something like 30-something million people. So about 10% of the population, not half. And Mark seems to think that about half the population is going to get exposed and be infected. We know that there's about 30 million positive cases in the U.S., or 30-something million, and that represents about 10% of the population. But listen to Mark's concern.
Are those the projections that you're seeing, or how much do you think that depends on how the response goes?
Well, that's a great question, Mark, and it really depends upon how successfully we mitigate in the sense of physical separation while the virus is essentially going free in society. Because if you can mitigate well, I think that 50% is a high number. In fact, even in some of the pandemics, you're down to 15, 20, 25%. A number of 50, if you do nothing to mitigate it, you may get there. But if you do some of the things that we're doing right now, I doubt if it's going to be 50. You never can tell because it's a new virus, but I would be surprised if it went that high.
Now, Fauci appears to be playing with a cough lozenge. We know from an earlier interview that he did with Chris Stiegel in Philadelphia that he had influenza. That was pointed out by Adam Curry pointed that out. So it appears he's playing with a cough lozenge or something here. But yeah, Mark is concerned that half the population is going to get exposed and get sick, and right now the numbers are sitting at about 10% of the population.
All right, so some parts of the country now have these shelter-in-place orders or guidance. What do you think is important for people to know about those?
Well, the first thing when you talk about shelter in place is that the people who absolutely need to do that namely self-isolate, according to the guidelines, which say do it for 15 days and see what happens, are the people who are most susceptible to getting seriously ill and dying. There's a great disparity among the demography of our population about who's at risk for getting into severe complications.
Now, this is very interesting. Listen very carefully to what Dr. Fauci is about to say.
Younger people, it isn't all or none, but for the most part, people who are young and healthy will get infected. They'll feel a viral illness, sort of like a flu-like illness. They won't feel well, but they likely would not need any specific medical intervention. However, very heavily weighted towards the elderly and those who have underlying conditions, heart disease, kidney disease, lung disease, diabetes, people on chemotherapy for cancer, they are much more likely to get serious complications, and the death and morbidity is very much heavily weighted to them. So if you're going to do anyone that needs to self-isolate, it's the people who are in the risk category. Regarding the younger people, asking people not necessarily to shelter in place.
All right, so first of all, he's acknowledging that older people and people with these underlying challenges like diabetes and other things that they're suffering with are going to be the ones that are most at risk. And we know from studying the comorbidity data that that is true. He also identifies that the people that need to sort of shelter in place and stay socially isolated are the people who are most at risk. And he identifies them as the elderly. So in March of 2020, Dr. Fauci was actually kind of level-headed and giving rather clear advice. So let's continue.
But to avoid crowds, don't go to restaurants or bars or places where there are a lot of crowds. If you're in an area and it's disparate, I mean, the country isn't homogeneous with regard to the outbreak, but if you're in an area where there's community spread, like there has been in Washington State and in some places in New York, then many people should be thinking about the possibility of essentially hunkering down for a while. But the ones that always should do it are those who are vulnerable, the elderly, and those with underlying conditions.
No, I think that advice has changed over time, and they've broadened that where they locked everybody down. But March of 2020, March 20th of 2020, this is what Dr. Fauci was saying.
Okay, well, some of the questions that have come on the thread and in my comments before were about, well, if young people have better health outcomes when they get this, can you talk for a minute about why is it so important that they take this seriously too? And how should they act to make sure that they can keep their families and the people that they love safe?
Well, Mark, that's the prevailing question, and it's a great question. That's a logical question that people ask. The fact is that even though young people will unlikely, as a group, with some exceptions, but as a group, will not get seriously ill from this, they will and can and will get infected. And what happens, even though they may be minimal symptoms or no symptoms at all, they become the vector to infecting those people who are vulnerable, who can get in trouble. So it really is one of those things, Mark, where we're all in it together. Even though individuals who are young feel that they're somewhat invulnerable, I certainly felt that way when I was very young. You may be invulnerable to serious things. No one is invulnerable completely, but it's less likely that you'll get seriously ill. But you have a responsibility, not only to yourself, but to society in general, particularly the vulnerable people.
All right, so what's interesting here is that in another setting, Dr. Fauci says something somewhat different. And I'm going to cut over to another video of him at the White House, speaking at the White House. Now let's take a listen to what he says here. Asymptomatic spread is what he was just talking about with the children. So let's hear what he says here in this setting.
But the one thing historically people need to realize that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
All right, so with that as a baseline, we're going to go back to what Dr. Fauci was talking about before. So go back to the interview, and let's just roll back a little bit listening to him talking about the kids again and what he thinks about the kids. But if they're asymptomatic,
you may be invulnerable to serious things. No one is invulnerable completely, but it's less likely that you'll get seriously ill. But you have a responsibility, not only to yourself, but to society in general, particularly the vulnerable people.
Yeah, so some other questions that we're getting in the comments are, and there are questions from people who, one person, Joseph, says, we live in Florida, and there are some people here who believe that hot, humid weather will kill the virus, so with the implication that it might not affect them and they may not need to take some of this guidance and this guidance and orders seriously. What's the latest scientific thinking on that, and how should people who have that question respond?
Okay, it's a good question. I'll try to make it as succinct as possible. Putting coronavirus aside, in general, respiratory illnesses such as influenza and the relatively benign common cold viruses tend to do very well in cold, dry weather. And when
so we just brought up influenza, and what's interesting here is that it's already March 20th, and since January 1st, there's 4,000 people a week dying in the United States from influenza P&I, and coronavirus deaths haven't even gotten into haven't reached 500 yet. So with 4,000 people a week dying of influenza in the United States, and it's now March 20th, he's, deeper than 10 weeks into this. And he's talking about influenza here, yet he doesn't mention Tamiflu. He doesn't mention Romantadine, Relenza, Xofluza. Doesn't mention any of these approved antivirals from the FDA, which is kind of strange. So let's continue. Let's see where he goes with this.
Warm, moist weather comes, people go outside, they're not congregated indoors, and viruses generally like cold, dry weather versus warm, moist weather. That is a fact, but we have no idea, since this is a brand new virus, whether this virus is going to follow that paradigm, and whether or not when it gets warm in the northern hemisphere, I live in Washington, it's, we're just at the end of our winter and the beginning of spring, we cannot absolutely expect it's going to go down. Although most of the time with other viruses, it does. So when someone in California says, in general, viruses don't do very well, the fact is you've really got to be careful because you're dealing with a unique virus whose characteristics and behavior are unclear to us right now.
All right, so you talked a little bit about the projections.
You notice how after every time Anthony Fauci speaks, Mark Zuckerberg, all right, so, and moves on to the next topic. There's no engagement, really. It's like Mark has a list of questions. He's eager to get to the list of questions. He's on the clock. He has 30 minutes, and there's just no dialogue, really, between him and Fauci. He's got his questions. He asks his questions. Fauci responds, okay, and he moves on.
But a lot of people are asking, what should we expect over the coming weeks and months ahead? How long should we expect these kind of orders to be in place, and how long should we generally expect that to be on high alert for? Anything that you can give in terms of guidance for what people should expect in the weeks and months ahead, I think would be useful.
Yeah, that's a good question, Mark. I mean, when the guidance and the guidelines and the suggestions were put out officially from the government, it was said as a 15-day period. That does not mean it's only going to be 15 days. It means at the end of 15 days, we'll reevaluate and see if what we've done have had any noticeable impact, and is it worth going on.
As I'm recording this, we're 15 months from when this was recorded, March of 2020. So 15 months later.
I would project personally, though it's always dangerous to make these kinds of projections, that we will go longer than 2 weeks. Because if you look at what the virus has done in other countries, it doesn't just turn around over a week and a half or two. It tends to go up. The stronger your mitigation activities are, the less the impact will be. But I believe it likely will be more than just 2 weeks.
And what do you think the likelihood is of another wave of this, either in the fall or later? So maybe we'll get this outbreak under.
So this is an important question. How does Zuckerberg even know about second waves and binodal outbreaks? And why would he expect that, given that MERS didn't kill 1,000 people? SARS and MERS, between the two of them, haven't killed, I don't think, 5,000 total. One, I think, is 800, and the other, I think, is less than 2,500 in the whole world. So why would Mark Zuckerberg think there'd be a second wave if we never had a second wave with any of the previous coronaviruses? So I found that a little bit curious. But let's listen to this response from Fauci.
But what are you worried about, or what do you project and expect there?
Okay. What I certainly would like to see is what happened with SARS. You remember back in 2002, the severe acute respiratory syndrome of SARS, which originated in the Guangdong province of China, had about 8,000 cases and about almost 800 deaths for a mortality of about 10%. When public health measures essentially suppressed it, it disappeared. It never came back. I'm afraid, Mark, that this virus is going to be a little bit different. Even though it's the same category of a coronavirus, it spreads too efficiently. So what I would think is likely, not inevitable, but likely, that once we suppress it, and we will get over this massive outbreak that's global. Once we get by it, it is conceivable and maybe likely that when we get to the next season, we may see another blip of this. But it would really be different, and I'll tell you why it's different. Because a certain percentage of the population will already have been immune, a bit of what we call herd immunity. We likely by that time will have tested a number of drugs. Hopefully some of them will be effective in treatment. And
Well, isn't that interesting? We will have some drugs that will be effective for treatment. So let's listen to this part, because this is interesting.
Mentioned just a couple of days ago, we started a vaccine trial, and we hopefully within a year to a year and a half would have a vaccine. So although
we hopefully within a year to a year and a half will have a vaccine. A year to a year and a half from March of 2020. How does Dr. Fauci come up with that time frame? Does he explain it? Yes, he does. Dr. Fauci.
We're preparing and maybe expecting for it to come back. It's not going to come back in the same circumstances as it first came.
Sure, and I want to get to the vaccine and other potential therapeutic strategies in a few minutes. But before we get to that, just as you're thinking about, as people start coming back to work and going back to offices and doing events again, we're talking about potentially another wave in the fall or in a following season. But what is going to prevent it from just flaring up again as soon as people just go back to living the way that they were before?
Right. That's a good question. And I have to, as I always am, Mark, quite obvious. That's something that we need to feel as a possibility. So we're going to test that. In fact, even as you and I are speaking here, it's being tested, because China went way up and they really locked down. I mean, if you want to talk about locking down, see what China.
All right, so he's watching China. He's talking about China. He knows they locked down. He knows where they're at. Why doesn't he say, hey, Mark, you know that there's not even 10 people dead in Beijing? You know that there's not 10 people dead in Shanghai, Mark? Why doesn't he say that? It's not relevant? It's not true? The WHO is reporting bad data? Johns Hopkins is reporting bad data? I'm confused. Why does he not bring that up? He's talking about China. Let's continue. Let's hear what Fauci says.
I mean, they essentially shut down entire cities of 10 to 20 million people. And they did it, and the epidemic in their country went way down to practically nothing. There were less than a handful of new cases yesterday in China.
So practically nothing as far as cases. He's talking about yesterday in China. It appears that he knows that there's not that many people dead. It appears that Fauci realizes there's not 5,000 people dead in China. This is interesting.
China. Very, very few. What's happening now is the Chinese are reconnecting their society. They're coming out from hunkering down. They're coming out from locking down. If we see another blip in China, that will be ominous, because that will mean that if you lock down and you prevent a big blast of infections, there's a chance you may have a rebound. So we're watching very closely what's going on in China now.
We're watching very closely what's going on in China now. There aren't 5,000 people dead in China right now. So if that's the case and you're watching really closely and there's not 10 dead in Beijing and there's not 10 dead in Shanghai, and at the time, March of 2020, there weren't 10 dead in Hong Kong. Did you tell this to President Trump? How come you didn't mention this on television? You were on television quite a bit, Dr. Fauci. You didn't think that it would be relevant to tell people that maybe we should take a look at what they did in Shanghai or what they did in Hong Kong, that today, July 1st, 2021, there's not 500 people dead in Hong Kong. There's not 10 dead in Shanghai or Beijing. And you didn't think this was relevant? You just said you were watching them very closely, Dr. Fauci. How did you not think that the actual number of people that died would be relevant? Let's continue.
Because they're getting back to normal. They're trying to get back to normal.
That makes sense. So as part of the public health response, what has been the biggest issue with rolling out testing more broadly, and what are the biggest?
All right, this is going to be very interesting. So this is March of 2020, and Zuckerberg is going to ask Fauci about testing. And you see how Fauci's already looking down, looking at his candy, because he's being asked about testing. Now, we were told that all of the CDC's test kits that they had in the emergency stockpile were contaminated. That was the story that was spun, but that might have happened after this interview. Let's hear what Dr. Fauci tells Zuckerberg, because this, this seems like it's just like a private Facebook-only kind of meeting, and maybe Fauci's sharing some things that he wasn't sharing with the public. I don't know. Let's see what Fauci says.
Barriers to expanding testing capacity going forward here?
Well, going forward, it's the good news. What's happened is, sobering and unfortunate, in that the original system that was put into place for these kinds of responses was not really suited in the best possible way for broad blanket type testing that many millions of people.
Now, is what Dr. Fauci is suggesting is that culture-based testing is not suitable and that we need to do PCR tests because we know PCR tests are faster. But he's not being specific. He's not saying that the test kits that we had in the past were cultures. We want to use PCR. He's not telling us exactly what the issue was. But it sounds like he's just saying that he didn't like the test kits. Let me roll this back and let's listen to this little portion here again, because I think this is somewhat pivotal in how the test kits were used to pull this off. So let's listen again.
What are the biggest barriers to expanding testing capacity going forward here?
Well, going forward, it's the good news. What's happened is, sobering and unfortunate in that the original system that was put into place for these kinds of responses was not really suited in the best possible way for broad blanket type testing that many millions of people would want. It was a test that for certain situations worked well, which depended a lot on the CDC, the public health institutions in the state, and the physicians to ask for a test to go through that process. What it didn't do early on is something that, as lessons learned, we clearly will do in the future and are doing now, is to involve the private sector. The heavy.
I don't hear a single thing about contamination. What happened to the contamination part of the story, Dr. Fauci? I thought that all the test kits were contaminated. That was the story we were told. What I'm hearing here is that you don't think it's adequate for broad-scale testing and it's too dependent on the CDC and the national health, and you want to get private industry more involved? Huh. This is different from the narrative, I believe. I could be wrong. Let's continue.
Hitting companies who do this for a living, who can give you high throughput testing in the tens of millions.
So he's talking about companies like Quest Diagnostics. We know they're doing testing now. But is the insinuation that we wouldn't be able to do cultures? I mean, what seemed to be wrong with the testing capabilities that the United States had in March of 2020 that we were unable to test people for such a long time? He's not mentioning the contamination, and I find that interesting.
Opposed to something that's a little bit more constrained. So looking forward, we will soon, maybe already, start to see an escalation of the capability of not only getting testers out there, but to be able to implement them. But that's a big lesson learned for next time.
Yeah, so how far off do you think we are from having the testing capacity we need? Is that days, weeks, more?
Yeah,
I mean, I know that our philanthropy at the Chan Zuckerberg Initiative just announced today that we're partnering with Governor Gavin Newsom and UCSF here in the Bay Area to increase capacity to more than 1,000 tests per day over the next few days. But nationally, do you think we're at that kind of scale in the next days or weeks, or how far off are we?
I think we're going to be heading towards that scale in the next several days, and certainly in the next couple of weeks. We have been promised by the companies that they'll be able to get the testing out there in a much higher volume than what we have in the past. That's not what I do, Mark, so I can't personally guarantee it, but from what I'm hearing and seeing, I think that the right people are in the right place doing that right now.
All right, well, moving on to another thing that may not be what you personally oversee, but you certainly have good visibility into this. A lot of people right now are worried about a spike in the number of patients overwhelming the hospital system and the medical.
All right, before we move to this next topic, back to testing. The issue with testing is, why are we testing people if when they test positive, you don't have a therapeutic that you can prescribe to them? In other words, if you're just going to test people and say, yeah, you're positive, sorry, go home, without any treatment, that just seems like a strange thing to do. So there was a lot of testing of people, but the only FDA-approved therapeutic was not an oral drug. It's intravenous only, which is remdesivir. And we're going to talk about remdesivir with Dr. Fauci in a moment here. But when we talk about testing and test kit availability and rolling out the tests and getting all the tests done, it seems like testing without a therapeutic treatment, again, I don't know. It's like checking the oil, but you can't buy new oil. So what the hell difference does it make whether your oil is low or not if you can't get any new oil? Why are they testing everybody if there's no treatment to give them? What difference does it make? So I never understood that. Let's continue with this interview with Dr. Fauci and Mark Zuckerberg that was conducted or published March 20th of 2020.
System across the country. So how concerned are you about this and shortage of beds, ICUs, personal protective equipment like masks, ventilators? How are we doing on addressing a potential shortfall, and what more should we be doing there?
Yeah. So whenever you have, and it happens rarely, but whenever you have an outbreak that really is a full-blown explosive outbreak, even the best of preparations can get overwhelmed, particularly of the elements that you describe.
All right. Let's break down this question that Mark asked. And why would Mark ask this question? This is March 20th of 2020. I don't think there's 500 people dead in the United States. And he's worried about beds and hospitals are going to run out of beds? Why would you think that was going to happen? There's not 5,000 people dead in China. So what would give you the impression that something like that might happen, Mark? Let's go back a little bit and let's listen to this question again. Why is he even asking this? Is this really his concern, or was this question written for him to sort of prepare people for what might be happening? So let's listen to the question again and see where Fauci goes with it.
It may not be what you personally oversee, but you certainly have good visibility into this. A lot of people right now are worried about a spike in the number of patients overwhelming the hospital system. And
a lot of people are worried about that? Who's worried about the hospital system getting overwhelmed on March the 20th of 2020 when there weren't 500 people dead in the United States? Why would you be worried about that? Where did Mark Zuckerberg get this question from? And watch where Fauci goes with the answer.
System across the country. So how concerned are you about this and shortage of beds, ICUs, personal protective equipment like masks, ventilators? How are we doing on addressing a potential shortfall, and what more should we be doing there?
Yeah. So whenever you have, and it happens rarely, but whenever you have an outbreak that really is a full-blown explosive outbreak, even the best of preparations can get overwhelmed, particularly of the elements that you describe. Respirators, ventilators, beds, ICU, things like that. Right now, we have a strategic national stockpile that has about 12,700 ventilators, tens and tens of millions.
We get to the strategic national stockpile, which is a great subject. And this is one of the first and few times I've heard Fauci bring this up. So the first thing he tells us is how many ventilators are in the national stockpile. Now, the number of ventilators, he just said it, so I'll go back just a couple seconds here, and you get to hear this again.
Things like that. Right now, we have a strategic national stockpile that has about 12,700 ventilators.
12,700 ventilators in the strategic national stockpile. So there's 340 million people in the United States, and there's 12,700 ventilators. Now, were there 12,700 ventilators when President Trump took the oath of office? Were there many, many more than that, and he sold them? Were there fewer than that, and he added more? I mean, did Obama have 12,700? Did George Bush have 12,700? I mean, why that number? It seems like a low number if you've got 340 million people and you've got 12,700. In fact, Governor Cuomo, when he said it's all about the ventilators, he was talking 40,000 ventilators. So the strategic national stockpile wouldn't have been adequate to simply meet Governor Cuomo's needs, Dr. Fauci. Why are there only 12,700 ventilators in the national stockpile? Let's continue.
Tens and tens of millions of masks. It is a possibility that that could not be.
Tens and tens of millions of masks. So that sounds like it's 20 million, 30 million, 40 million. It's not 100 million, or he would have said, we've got 100 million masks. So we have tens of millions, something like 20, 30, 40, 50 million masks in the national strategic stockpile. And then later, we know that Dr. Fauci comes on and tells us that you don't necessarily need to wear a mask at this stage of the outbreak, right? So he tells us that in an interview with 60 Minutes, right?
Confusion among people and misinformation surrounding face masks. Can you discuss that?
The masks are important for someone who's infected to prevent them from infecting someone else. Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask.
So that was Dr. Fauci on 60 Minutes at one point during the outbreak. So let's continue with this interview with Zuckerberg, but he's talking about this national strategic stockpile, and we just found out that we've got tens of millions of masks and 12,700 ventilators, which is not enough for Governor Cuomo just to get through the outbreak. Let's continue.
Enough. And if it's a big, big outbreak, it won't be enough. So what's happened most recently over the last couple of days, a number of initiatives have occurred from the White House, from the president. One is to get the Department of Defense to be putting in a considerably larger number of ventilators to make available in case our strategic national stockpile is not enough. In addition, many, many millions of masks are going to be available, the respirator masks, the N95s. So we could get overrun. We could have a paucity of beds. Two of the Navy ships, the Comfort and the Mercy, are being mobilized, one being sent right now.
Whoa. The Comfort and the Mercy are already being mobilized. It's March the 20th. How many people are dead in the United States and we're moving the military ships around, huh? For COVID? There's 4,000 people a week dying of influenza. Why are they moving ships around for COVID? He just said he's watching China, so he knows that there's not 5,000 people dead in China. Why are they moving ships around? And Zuckerberg's worried that the hospitals are going to get overrun? Based on what? Based on what happened in Hong Kong? Based on what happened in Shanghai? Based on what happened in Beijing? Based on what happened in Vietnam? Bangkok? Interesting. Let's continue.
The New York area, because they're having a particular problem in New York, in case they get overrun with lack of beds, then we could put patients who would normally be in a regular bed in the hospital ship and putting. Why
would they think this would happen? that we're going to run out of hospital beds in New York City March the 20th. There's not that many people dead March the 20th. There's not 10 dead in Beijing. There's not 10 dead in Shanghai. There's not 10 dead in Hong Kong. There's not 10 dead in Vietnam. There's not 10 dead in Bangkok. Why does he think this is going to overwhelm the hospital systems and that there should be ships on their way to New York, the Comfort and the Hope, or whatever the hell the names are? Why would you think that's going to happen if SARS and MERS didn't kill 5,000 people total? Why would you be expecting these kinds of death tolls? That's the part I'm kind of confused by, but let's continue.
People with coronavirus infection and COVID-19 disease in the regular hospital beds. So it's a possibility that we might have a problem, but I see a lot of activity trying to obviate that problem.
And what do you think that, is it a shortfall in all of those resources, beds, ICUs, PPE, ventilators, or are there some things that are more acute than others? Because I've heard discussions around, for example, should hotels be converting into providing extra beds for hospitals? How do you think about when the right time to do that is, when you have an outbreak that's spreading quickly and it would probably take a couple weeks to stand up converting a hotel or something like that into a place that could be a medical facility?
Now again, what the hell is he talking about? Converting hotels to medical facilities. It's March 20th, 2020. There aren't 10 dead in Beijing. No one's dead in Vietnam. No one's dead in Cambodia. No one's dead in Laos. No one's dead in Mongolia. And they're worried that the United States medical system is going to be overrun and they're going to have to convert hotels. Are these guys watching a movie that the rest of us were not watching? Why would they be thinking that this was going to be the outcome? Based on what? Let's continue.
Well, one of the things we can do right now, and I think the hotel thing, I think we need to think about that seriously, Mark, and prepare for it, including, possibly universities where people are not coming back to school. I think that's.
All right, what we know is that the government put field hospitals in just about every major city around the country. So from the San Jose area, Seattle, Portland, Chicago, Miami, New York, Texas, Louisiana, Rhode Island. There were field hospitals all over the country that were deployed in the event that the hospital system was overrun. And it appears that this was put into motion already because Dr. Fauci's mentioned the Hope and the ships that are on the way. We know that the president declared this national emergency a week earlier. And it sounds like the field hospitals are on their way. So these guys are talking about field hospital concepts. And there's not 5,000 people dead in the United States, but there's 4,000 a week dying from influenza. And no mention of that. It's kind of bizarre, but let's continue with Dr. Fauci and Mark Zuckerberg, see where they go with their conversation.
Another possibility to consider. But one of the things we could do right now, literally today, is to get hospitals throughout the country to delay and cancel elective surgical and medical admissions. Because once you let people in who have a procedure that they won't need right now, I mean, that's the way you chew up a lot of resources: beds, masks, personal protective equipment.
Yeah. All right. So moving on from what will hopefully be resolved in the next couple of
again, Zuckerberg with, yeah, right. Okay, moving on. Very dismissive of Fauci. There's no real engagement in a dialogue. they cover the bullet points and they move on. And yeah, right, okay. And very, very dismissive on the part of Zuckerberg. I'll rewind so you see how he wraps up that last point with Fauci again.
That's the way you chew up a lot of resources: beds, masks, personal protective equipment.
He's watching the clock.
Yeah. All right. So moving on from what will hopefully be resolved in the next couple of weeks on the spike here, let's talk about some of the longer-term strategies for addressing this. You mentioned the vaccine. There are conversations about other therapeutics. Maybe talk for a minute about where are we in the vaccine development. You just announced the first trial for phase 1 to test the safety. What's the time frame for having something like that go through all of the different trials?
Now, this is huge. This is sort of the reason we're here, is what Fauci's about to say. So pay very close attention. Let me rewind again. Listen carefully to the question that Zuckerberg is asking, and then watch how Fauci answers this. This is March of 2020, and this is really pivotal.
Vaccine development, you just announced the first trial for phase 1 to test the safety. What's the time frame for having something like that go through all of the different trials? How could we expedite that? What should people expect on that?
Okay, so if you look, to give our viewers and listeners a perspective, if this were, 10, 15, 20 years ago, and it was for any vaccine that we wanted to make, you would say a vaccine from the time you start to the time it's approved to be safe and effective is several years, 5, 6, 7 years. That's unacceptable for now. So what happened is that as soon as we got the sequence of the virus from the Chinese, we pulled it out of the public database and stuck the gene into a vaccine platform and worked on it literally.
All right, so he's already acknowledging he got the genome from the Chinese. So all this China's lying stuff, they published the genome in GenBank. He just told you that. And he said, then we went to GenBank and we downloaded it and we started working on the vaccine. So this China is lying narrative thing, China published the genome very early in January, and he just told you that he downloaded it. So I'm not sure what the China lying part is. So let's listen again.
Sequence of the virus from the Chinese, we pulled it out of the public database and stuck the gene into a vaccine platform and worked on it literally within a day of when it came out. 65 days later, namely 2 days ago, we gave the first injection to a normal volunteer for a phase 1 trial to see if it's safe. That's the fastest that's ever been done. That's the good news. The challenging news is that even at that rocket speed, it's going to take a few months to show that the initial safety is okay. Then you go into a phase 2 trial, which instead of involving 45 people, which we have in the phase 1 trial, it involves hundreds, if not thousands of people. That will take another 6 to 8 months to even know if it works. So at the fastest we can go, it's going to take a year to a year and a half.
Whoa. So he says it's going to take 6 to 8 months to get through that second phase. And then a year to a year and a half. Let's roll back. Let's listen to this again. He's very specific. Let's listen to what he says.
That's the good news. The challenging news is that even at that rocket speed, it's going to take a few months to show that the initial safety is okay. Then you go into a phase 2 trial, which instead of involving 45 people, which we have in the phase 1 trial, it involves hundreds, if not thousands of people. That will take another 6 to 8 months to even know if it works. So at the fastest we can go, it's going to take a year to a year and a half to know if we have a vaccine that we can use. So apropos of the question you asked me a moment ago, that if we cycle to another season, that's when a vaccine is going to be very relevant.
So one of the questions that I've heard from a number of people is, doing the safety trials obviously is incredibly important because you want to make sure that you're not injecting people with something that could be harmful. But once you have that, why not push harder on rolling it out more aggressively, even if you don't know exactly how effective it is? What's the public health rationale and thinking behind?
So Mark the genius wants to go aggressively, whether or not it's effective. So he's saying as long as it's safe, what difference does it make if the efficacy is, let's say, 20%? So what? As long as it's safe, let's just roll it out like we do with influenza vaccines that are only 30 to 40% effective. So I think that's kind of the pathway he's going down, which is, should we really get that caught up on its efficacy if it's safe? That's one way to skin a cat, I guess, Mark. It's probably a good reason why you're not an epidemiologist and why you're in the software business, because I doubt that's a great idea. And we're going to hear from Fauci what he thinks of your idea.
And needing to prove that it's extremely effective before rolling out something that you know is safe.
Okay, that's a good question. The initial safety study, Mark, is to see if I inject it in the arm, does it have some sort of idiosyncratic or bad reaction? There's another element to safety, and that is if you vaccinate someone and they make an antibody response and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse? And the only way you'll...
What? What? Does the injection make the infection worse? I've never heard this ever, and I'm old. I've never heard that getting a vaccine could potentially make the infection worse. Let me roll that back. Did I hear that correctly? I might need you guys to double check what I think I heard here. Let's listen to this again.
To safety, and that is if you vaccinate someone and they make an antibody response and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse? And the only way you'll know that is if you do an extended study, not in a normal volunteer who has no risk of infection, but in people who are out there in a risk situation. This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse. There was the history of the respiratory.
To me, this is a stunning revelation. It would not be the first time that a vaccine actually made people worse. According to Dr. Fauci, I'm rather stunned that we're hearing this. Let's go back and listen to this again. Make sure that we're all not hallucinating together. Let's hear what he said.
You do an extended study, not in a normal volunteer who has no risk of infection, but in people who are out there in a risk situation. This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse. There was the history of the respiratory syncytial virus vaccine in children, which paradoxically made the children worse. One of the HIV vaccines that we tested several years ago actually made individuals more likely to get infected. So you can't just go out there and give it unless you feel that in the field, when someone is getting infected and exposed, being vaccinated doesn't make them worse.
I'm not sure I even knew that this was a scenario. I didn't know that that was even an option. And it sounds like what Dr. Fauci said at the beginning of this portion is that that's what requires the months of testing, is to make sure that that's not the case. So originally he said it's going to take a year to a year and a half from March 2020 because of this type of testing. Let's go back a minute or so and cover this section because, again, I never knew that a vaccine for a given affliction could make the affliction experience worse. I never knew this. So I'm learning something from Dr. Fauci. Let's jump back and listen to this portion again.
It was for any vaccine that we wanted to make. You would say a vaccine from the time you start to the time it's approved to be safe and effective is several years, 5, 6, 7 years. That's unacceptable for now. So what happened is that as soon as we got the sequence of the virus from the Chinese, we pulled it out of the public database and stuck the gene into a vaccine platform and worked on it literally within a day of when it came out.
Now, that's a gene synthesizer. So they take the gene sequence from GenBank, and they take a gene synthesizer, which is the machine that clones puppies and kittens and horses, and they tell it to grow the virus. And that's exactly what they did here. So let's continue.
65 days later, namely 2 days ago, we gave the first injection to a normal volunteer for a phase 1 trial to see if it's safe. That's the fastest that's ever been done. That's the good news. The challenging news is that even at that rocket speed, it's going to take a few months to show that the initial safety is okay. Then you go into a phase 2 trial, which instead of involving 40.
So he's suggesting it's going to take a few months to show initial safety. And he said they just did it 2 days ago. So they're mid-March. So he's saying April, May, June. So by the June timeframe, 90 days out, they'd have initial safety.
5 people, which we have in the phase 1 trial, it involves hundreds, if not thousands of people. That will take another 6 to 8 months to even know if it works.
So that would be June. 6 or 8 months from June would be December, January, February of 2021. But we were already rolling it out in December of 2020. So he's saying we normally would need 6 to 8 months just to know if it's effective, to know the efficacy of it.
So at the fastest we can go, it's going to take a year to a year and a half to know if we have a vaccine that we can use. So apropos of the question you asked me a moment ago, that if we cycle to another season, that's when a vaccine is going to be very relevant.
Well, this seems completely different from what ended up happening. It sounds like Dr. Fauci has, at this point, kind of resolved to the fact that he's not going to have a vaccine to the public for over a year. So at some point, this changed in a big way. And they went from him thinking we're not going to have anything until a year, year and a half from now, to we're going to have something before Christmas, which is pretty remarkable. So let's continue.
So one of the questions that I've heard from a number of people is, doing the safety trials obviously is incredibly important because you want to make sure that you're not injecting people with something that could be harmful. But once you have that, why not push harder on rolling it out more aggressively? Even if you don't know exactly how effective it is, what's the public health rationale and thinking behind needing to prove that it's extremely effective before rolling out something that you know is safe?
Okay, that's a good question. The initial safety study, Mark, is to see if I inject it in the arm, does it have some sort of idiosyncratic or bad reaction? There's another element to safety, and that is if you vaccinate someone and they make an antibody response and then they get exposed and infected, does the response that you induce actually enhance the infection and make it worse? And the only way you'll know that is if you do an extended study, not in a normal volunteer who has no risk of infection, but in people who are out there in a risk situation. This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse. There was the history of the respiratory.
All right, so I fully expect you're going to hear this on Dark Horse podcast from Brett Weinstein. Heather's probably listening now. We'll take this information and present it as her own, as she tends to do. So you'll probably hear this. You'll probably hear this from Maria Bartiromo. You're probably going to hear this from Tucker. This is rather stunning. I didn't know that this was a possibility. I'm guessing a lot of you guys didn't know that this was a possibility. And although Dr. Fauci shared it here with Mark Zuckerberg and the folks at Facebook, I don't know that we've heard a whole lot about this. So let's continue with this interview. I'm hoping that you guys are learning some new things here. I certainly am.
Syncytial virus vaccine in children, which paradoxically made the children worse. One of the HIV vaccines that we tested several years ago actually made individuals more likely to get infected. So you can't just go out there and give it unless you feel that in the field, when someone is getting infected and exposed, being vaccinated doesn't make them worse. That's why you got to do a trial.
Yeah, so that's important to get out there. So with that context of these extended trial periods, even when you're doing heroic work to get these a vaccine candidate tested quickly, one of the strategies that I've heard that I'm personally most optimistic about, and that at our philanthropy, the Chan Zuckerberg Initiative, where we're trying to help out with, is seeing if there are ways to test already approved compounds and drugs and therapeutics, things that have already gone through that cycle and have been proven to be safe and effective for fighting some disease, to see whether any of those compounds or drugs could be effective for either preventing or treating the symptoms of this coronavirus.
Now, if you look at the look on Fauci's face, he doesn't really like this question very much. And what I find interesting about it is where he goes with this. And, I mean, boy, you talk about a non sequitur. Let's watch his answer. And remember that we're talking about a coronavirus disease called SARS-CoV-2. So it's like the original SARS, meaning it's a coronavirus. So it's like SARS, it's like MERS. And listen to where Fauci goes as far as talking about therapeutics and testing existing therapeutics. Would this have been your first choice?
What do you think needs to happen in order to run through that process? I mean, I'm talking to a lot of scientists now who basically all have hypotheses of compounds or things that they'd love to get tested. What would you like to see have happen there to prioritize which ones are the most optimistic? And what do you think about that strategy overall?
Well, it's a great question because it's exactly happening, and I like the strategy. So there are a number of already approved drugs or drugs that have been developed but almost approved, not quite approved, that are now being looked at because of initial either in vitro or animal data work suggesting that they may be helpful. Give you some examples. There's a drug called remdesivir, which is a drug that was developed by Gilead as an antiviral. We tried it in Ebola. It didn't work as well as some of the other drugs.
All right, so whoa. We've got a respiratory infection, a viral respiratory infection. Why are we going to the Ebola failed drug from Gilead? And it wasn't designed as an antiviral that was tried for Ebola. It was designed for Ebola, and it failed and was not approved. So I think the question that many of us have that are not epidemiologists is, why wouldn't you go to something like oseltamivir or Romantadine or Zofluza or Rolenza? These are FDA-approved antivirals for influenza, which is a respiratory infection. Why would you go to the Ebola medicine? Why would you think that there's some sort of similarity between a SARS COVID coronavirus and Ebola? as opposed to another respiratory infection? Wouldn't an antiviral respiratory make some sense? And there's no mention of these other therapeutics that other doctors in other countries were having success with. So the more benign therapeutics that are used to treat things like lupus and are used to treat things like malaria, those aren't mentioned. So the fact that Dr. Fauci goes to the Ebola treatment, which also is not an oral therapeutic, it requires intravenous. What kind of strategy is that? So we're going to test 30 million people, 50 million people, and if you're positive, we're going to give you the Ebola medicine on an IV. That's the therapeutic course of action that he's excited about. It seems like a strange choice, given that there were all these other antivirals already on the market, and then a whole bunch of other therapeutic drugs that were being used in other places around the world, apparently to some degree of effectiveness. But no mention. He talks about Ebola medication. Why would you even think there is a similarity there? Why not leprosy? I mean, I'm having a real hard time understanding the connection between a coronavirus and Ebola. Why not leprosy?
It's there. What we're going to do now is there are clinical trials going on right now, both in China and in the United States, to see if it works. It's likely that one or more of these drugs, and there are several, are going to be out there to see an already developed drug if it can work. Another one is interesting. There's a lot of buzz on the internet about this, and that is a drug called chloroquine or hydroxychloroquine, which is a drug that's been approved for decades, very cheap.
Yeah, it's the old malarial drug.
Yeah, used in malaria and used in certain autoimmune diseases like lupus. There's some indication in the test tube that it might have some activity. The FDA said today that they are going to see if we can do some expanded use access, getting people who might want to use it off-label, namely since it's an approved drug. So your point is extremely well taken. One of the immediate ways for treatment is to look at drugs that you want to repurpose. While you're doing that, you want to start developing drugs de novo that are specifically targeted to the coronavirus itself. Those things will go on simultaneously.
However, 15 months in, the only FDA-approved therapeutic treatment in the United States is remdesivir. And the WHO doesn't recommend remdesivir. So it appears that the FDA and the WHO are at odds. They do not agree on the therapeutic treatment. And it's the only FDA-approved therapeutic treatment in the United States. Everything else that Dr. Fauci mentioned is off-label. And in some cases, we know in New York, I believe it's Tina Forte, was not able to fulfill her prescription because Governor Cuomo said, no, we're not going to allow that here. And I think there's a number of governors who did the same thing. So although Dr. Fauci talks about some off-label usage of drugs like he mentioned it, I think in the real world, it turned out that that was not something that people could actually do.
So are there any other, aside from the vaccine for prevention, and then some of these other drugs that may be good for prevention, but also could be good for treatment, so reducing some of the symptoms, the intensity of the damage in the lungs, which could just reduce it from potentially being a very dangerous disease to something that could be more manageable. What are the other long-term strategies that you see out there that you're optimistic about?
Well, I think the long-term strategy besides the drug, you have to go with trying to get a vaccine that's really effective. I mean, the history of viral diseases is that if we can get a vaccine, and I'm thinking in two channels, Mark. One, a vaccine for this specific coronavirus, but long term, just think about it. Since 2002, we've had 3 outbreaks of coronaviruses: SARS, which I mentioned a moment ago, MERS, the Middle East Respiratory Syndrome, and now this novel coronavirus. We should be and are and will be making a universal corona vaccine, which means you can make a vaccine that would be protective against any kind of coronavirus if you get it to make a response that's common to all of them. The same sort of thing.
All right, now that is not what Pfizer and Moderna, J&J are selling right now. This is not a universal coronavirus vaccine. So what Dr. Fauci is talking about sounds like it's a little further down the road a bit, because this is specific, I believe, to SARS-CoV-2, and there's no claim that this provides any protection to MERS or to the original SARS-CoV-1. So what he's talking about here, I think, is a vision for a universal coronavirus vaccine
that we've been doing for the past couple of years, trying to develop a universal influenza vaccine. To me, that's the best long-term goal for this.
Got it. So I want to take the last 5 or so minutes that we have to take some questions from the stream and the thread. I mean, a lot of people have specific questions about health information for themselves. So maybe we can go through this pretty quickly.
Sure.
Robert asked this question: if you test positive, when is it okay to interact with others?
Okay.
And the question should be, if you test positive, what medicine are you going to give me? That should be the question. Not, when can I go play with my friends? How about, if I test positive, what do I do so that I don't die? Why isn't that the right question here? I mean, this is just dumb. Let's continue.
That is a good point. Strictly speaking, if you are positive, you have the virus in you. And the way you determined positive was you got a nasal swab in your nasopharynx and you cultured the virus.
Now, it's interesting that Dr. Fauci uses the term cultured, because we're not culturing the virus. We're doing PCR tests. But by calling it a culture, that's a very interesting way to spin this. He says you culture it. No, they're not culturing it. It's being done in a PCR machine. And it's very different. If we were doing cultures, then we would find out what's really inside people's noses. But I don't think we're doing that.
Guideline is that in order to be able to feel safe in going out into society, you have to have 2 negative tests 24 hours apart. Namely, you're not shedding virus anymore, so you can feel free to go out. That might change. It may be more flexible. When we get a better feel for what the real bracket of time of people shedding, you may be able to be more flexible than that. But that's the standard, gold standard now.
So one of the questions I've seen asked by a lot of people is, one of the maybe more positive properties here is that it doesn't seem to have severe effects on children under the age of 9, which is good news. But then a lot of people wonder, okay, so if children don't seem like they're affected, are they carriers for this essentially? Or does it basically just run through them like a common cold, and then once they're done with it, then they're not spreading it either? I think that's a good thing to clear up.
Yeah.
All right, so addressing the child mortality issue is really important. We know that there aren't 300 school-aged children that have died with coronavirus, and that more kids have drowned in the United States than have died with coronavirus. So Mark is asking a good question. I don't know why he said 9 years old, probably because he doesn't have children that are older than 9. So he's just being narcissistic and he cares about his own kids. But the truth is, I'm talking about kids 5 to 18 years old, school-age kids from 5, kindergarten, to the end of high school, 18 years old, there aren't 300 dead in the United States. Okay? Now, Fauci seems to be aware that young kids are not being impacted. So let's see where this goes.
Now, we need to clear that up. And I think as we get more experience here and tap into the experience of our Chinese and European colleagues, we'll get the answer to that. For sure, what you said is factually correct. Children don't seem to get sick with this. The real question is, do they get infected? And from an infectious disease standpoint, I would predict that they do get infected, but they have such a mild illness that you don't notice that they're infected, or they don't show any symptoms. The easiest way to find out is to do broad screening of children.
But we heard earlier that asymptomatic spread doesn't drive pandemics. So if children get it and they're asymptomatic, Dr. Fauci already told us asymptomatic spread is not really that big a deal, right? We heard that video earlier, right? Let me change the video clip. Here's Fauci telling us asymptomatic spread doesn't really drive it.
But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
So if that's the case, then why are we worried about vaccinating all the children? That, you know, again, that's sort of the part that I find a little bit confusing. But, you know, again, that's just me. All right, so let's continue with our interview.
Figure out, are they really infected and asymptomatic, or are they not getting infected? I tend to believe that they're getting infected, but something about their system, the receptors in their lung, the nature of their immune response, is making it that they are not getting symptoms.
But then once they're infected and the infection runs its course and they're done, then my understanding, and correct me if I'm wrong, but I think that this is important for people to see, is that there's no such thing as a long-term carrier, right? So if a child has it, then they get the infection and then they're done, and they're not infectious once they're done as well, just like everyone else. Is that your understanding, or is that an open question?
Well, it's an open question, but all the evidence in other situations indicate, particularly evidence from China, indicate that once you are infected, you resolve the infection, you resolve the virus, you are not infected anymore. So we don't anticipate that we're going to have a problem where kids get infected, clear the infection, and then are a source to others. Even though it hasn't been formally proven, is highly suggestive that that's not going to be the case.
Yeah, and a similar question that I have here from Bladar is, can you get reinfected by the coronavirus if you've already had it?
Again, that hasn't been formally tested, but it is every reason to believe that this virus, when it comes to an immune response and long-term immunity, that it's not acting any different from any other virus. So I would project that once you're infected and you recover, that if you get exposed to this exact virus, you will not get reinfected. Remember, there are many different kinds of coronaviruses, but the one that infected you, you should be protected against.
All right. Well, I want to be conscious of our time. Is there anything that we didn't get a chance to talk about that you want to make sure that we address here?
You know, I think we spoke about it indirectly, Mark, but I would like to make a plea to the young individuals who are watching, the people, you know, adolescents, teenagers, people in their 20s and 30s, who we've mentioned and pointed out are so much less likely to not get a serious consequence of infection, to please understand that you will play a major role in ultimately containing this infection by not being careless and avoiding and not listening to the recommendations of physical separation. Please, because you are an important part of this whole process.
Great. And is there, as a closing thought, is there any source of information that you would point people to? I mean, a lot of the questions that I've gotten here are, what's the best source of information? There's a lot of conflicting information out there. What do you think people should go look at and rely on to get information on this going forward?
Yeah, there's two websites that overlap with each other. You can access one from the other. One is cdc.gov, but if you want to directly go to coronavirus information, just dial in coronavirus.gov.
Great. And Facebook has just launched the Coronavirus Information Center, which we're putting at the top of the app and at the top of the menu for the next period while this situation is going on, where we're aggregating a lot of information from trusted health authorities like the CDC and WHO and local governments as well. So you can check that out too. All right, Dr. Fauci, thank you so much for joining me for this. It's really important that people get a chance to hear from you. And I just want to thank you and all of the folks on your team and all of the medical workers and health workers on the front lines who are fighting this, who are all doing heroic work. And I think I can say this for a lot of people, but I'm extremely grateful for everything that you're doing. So thank you.
Thank you very much, Mark. It was a pleasure being with you.
You too. Good luck.
Thank you.
Oh, there we have it. Mark Zuckerberg, Dr. Fauci. A conversation from March of 2020. Did it answer any questions? And has it opened up a couple cans of worms that we didn't know were there? I thought that was interesting. Hypothetically speaking, I'm John Cullen. Thanks for joining.